Prevention is better than cure. Namaste friends, I am Ritesh and today's video is about JALANETI, and especially during this coronavirus pandemic, a video has been viral regarding the JALANETI for COVID-19 by Dinanath Hospital, Pune. Friends, don't get daunted by the description. It's not as difficult as it sounds. Usually, when people hear about JALANETI, their first reaction is, how can I put water inside the nose? But once they do it, the same people come back and say, this is so easy and amazing. This has been my experience with all my students. This video is a step-by-step guidance of how to do a JALANETI. So this video is divided into 4 parts. You can skip whenever you wish to. So first is preparation of JALANETI, step-by-step to do JALANETI, contraindications, benefits, and the research done on JALANETI. JALANETI, that is also known as a nasal cleansing technique with water. So the preparations are: first, the neti pot; second, the salt; third, lukewarm water; fourth is a towel or napkin to clean. Special neti lota or neti pot should be used. The lota may be of plastic, pottery, brass, copper, ceramic, or any other metal which does not contaminate the water. The nozzle at the end of the spout should fit into the nostril so that the water does not leak out. Even a teapot may be used if the tip of the spout is not too large or sharp. The water should be at body temperature and thoroughly mixed with salt in the proportion of 1 teaspoon per half a liter of water. The addition of salt ensures the osmotic pressure of the water is equal to that of the body fluids, thereby minimizing any irritation to the nose or to the mucous membrane. If a painful or burning sensation is felt, it is an indication that there is either too less or too much salt in the water. The body position in JALANETI. Now JALANETI may be practiced either in a squatting position or a standing with the shoulders and the head bent forward. Standing postings are best on a sink or wash basin, while squatting position is great for outdoor, in lawn, etc. Prepared salt water in the neti pot. Stand squarely. Put the body weight even on both feet. Lean forward. Keep the hands on the thighs. Relax for a minute or so. Relax the whole body. Take some time. Don't be in a hurry. Tilt the head to one side and take it back. Gently insert the nozzle in the uppermost nostril. No force involved. The nozzle should first firmly inside the nostril so that no water leakage out from the chin. Tilt the neti pot in such a way the water is moving into the nostril, not down the face. Adjust the body position. Relax for a few breaths. See that your mind and body is completely relaxed when you do it. It's all about the mental state. So if you have a fear, then it is difficult. Okay, just gently place it inside Okay, relax. Breathe in and out through the mouth. Tilt the head, take it back. Breathe. Be relaxed. So the next part is drying the nostril. So first try to be in center and just do. So you can see that water coming out. So gently. You can keep your one hand on the nose. Let all the mucus come out. Now tilt your head to your left hand side and just like a Kapalbhati. Then the other side. Perfect. Once again. Once again. That's it. You have done with your JALANETI. Duration. This practice should take about 5 minutes. Neti may be practiced once daily or as recommended by a yoga teacher or a therapist. To relieve severe colds, nasal, cataract or any other ailment, it may be performed up to 3 times daily. Awareness. Physical on relaxing and positioning the body, making sure no water leaks from the nozzle of the lota, and on a relaxed breathing through the mouth, especially for beginners. Spiritual on your Ajna Chakra. Sequence. JALANETI is ideally practiced in the morning before asanas and pranayam. However, if necessary, it may be performed at any time except just after meals. If any water enters to the throat or mouth, it is an indication that the position of the head needs to be adjusted. Make sure that the nose is properly dried after the practice. Otherwise, the nasal passage may become irritated and manifest the symptoms of a cold. Do not blow the nose too hard as the remaining water may be pushed into the ears. If necessary, perform Shashankasana, that is a rabbit pose for several minutes. Contraindications. Those people who suffer from chronic bleeding in the nose should not do JALANETI without expert advice. Those who consistently have a great difficulty passing water through the nose may have a structural blockage and should seek expert advice. Friends, have patience. It's a long list of benefits. JALANETI goes beyond nasal cleansing and helps in aligning your body, mind and soul. Hence, it should be practiced daily and not only when one has a nasal blockage, cold or any viral infection such as COVID-19. Remember, it's a preventive measure. Respiratory benefits. JALANETI removes mucus and pollution from the nasal passage and the sinuses, allowing air to flow without obstruction. It helps prevent and manage respiratory tract diseases such as asthma, pneumonia, bronchitis, pulmonary tuberculosis. It helps to relieve allergies, colds and sinusitis, together with various disorders of the ears, eyes and throat, including myopia, allergic rhinitis, hay fever, certain types of deafness such as glue ears, tonsillitis, and inflammation of the adenoids and mucous membranes. Mouth breathing in children can be reduced by practicing JALANETI. JALANETI relieves muscular tension of the face and help practitioner to maintain a fresh and youthful appearance. It strengthens the immune system by fortifying the cells present in the nasal epithelium. Mental benefits: it has a cooling and soothing influence on the brain and is beneficial in the treatment of anxiety, treatment of epilepsy and migraine. It alleviates anxiety, anger and depression, removes drowsiness and makes the head feel light and fresh. People have experienced a reduction in their anger by practicing JALANETI regularly. JALANETI stimulates the various nerves ending in the nose, improving the activities of the brain and the overall health of the individual. A balance is brought about between the right and the left nostril and the corresponding left and right brain hemispheres, inducing a state of harmony and balance throughout the body, and the systems governing circulation and digestion. Sense of smelling, overall health improves. Acting as a protector of mucous membranes, helps breathing and pranayama, increases the frequency of that cilia beat to remove mucus. Most importantly, however, Neti helps to awaken Ajna Chakra. Variations. So advanced practitioners may suck the water up to the nostril directly from a glass or a bowl. This is the original form of this practice and is called Ushapan, which literally means water of the dawn. Other liquids are used by Hatha yogis instead of water in the practice of Neti. These include warm milk, that is known as Dugdha Neti, warm clarified butter or ghee, that is known as Ghrita Neti, or even yogurt may be used. If oil is used instead of ghee, it must be natural and without added chemicals. However, the most powerful form of Neti is practiced with urine, Amroli, and is known as Swamutra Neti. This form is particularly useful for alleviating inflammation of the nasal passage, sinusitis and migraine. Each liquid bestows a different benefit. None of these variations, however, should be attempted unless specifically instructed by the guru or teacher. Types of salt to use and salts not to use. Friends, ideally pure sea salt should be used if available. Here I mentioned different types of salts available in the market, suitable and not so suitable for JALANETI. So first one is cooking salt, or also known as pickling salt. This is generally nothing other than pure sea salt. The finer, the better, for quick and even dissolving. If you can't get it fine, grind your own from whatever you can find. Store airtight to avoid lumping up, found in supermarket and health shops. The second one is table salt. This is just finely grounded cooking salt with a free flowing agent in it to stop it from lumping up. We don't need aluminium, silicon or iodine in the nose. This salt can be used for JALANETI without any harm when cooking salt is not available, but try to avoid if you have a choice. Kosher salt. This is a sea salt that is guaranteed to be pure and has no pollutants or other substances. Microbiotic salt, often grayish in color, usually just sea salt from Japan and therefore more expensive than local salt, may be used for Neti with no harm. Vegetable salt. This is a compound mixture of salts, herbs and spices and will do your nose and olfactory senses no good at all. So don't use it. A rock salt. Depending on the origin, rock salts have other minerals in them and are therefore not recommended for Neti. They are usually very big hard crystals requiring a salt cellar. Nice for cooking with, but not for your nose. Friends, recently a research was done by Dinanath Hospital, Pune, on JALANETI, one of the ancient techniques in yoga for nasal irrigation, claiming that traditional JALANETI is helping them steer clear of COVID-19. Medical professionals regularly practicing this yoga technique properly say that they have remained free of the infection despite their high-risk job. 600 healthcare staff participated voluntarily for the study and signed up for practicing JALANETI regularly twice a day. A record was kept to check on who is practicing regularly and who is not. People who could not follow it properly were recorded separately as defaulters. The research was done with three group categories: those who did not sign up for the study, those who signed but rarely practiced, those who practiced regularly. So as per the data for the last 3 months, the doctors have claimed that those who regularly did JALANETI managed to stay free of COVID-19. Around 22 healthcare staffers got infected as they neither participated nor followed it regularly. Friends, the COVID-19 virus is a respiratory disease. The virus gets locked in the nostril. It has been found that a person tests positive on the 4th day after this happens. So the virus seems to establish a colony during these 4 days. When you do JALANETI, we try to wash out the virus and reduce this colony, and hence reduce the viral load on a daily basis via this method.